This year, the opioid crisis will meet its newest opponent. That is the Maryland Public Schools, who will be required actually, to stock anti-overdose drugs in order to prepare for possible overdoses on school campuses. Henry, is this the appropriate action for the school systems to take in Maryland?
I think it's a good start. The welfare of our kids should always be a priority. And introducing Narcan, which has no negative side effects if you give it to someone who is not overdosing. Introducing that and having someone who's trained to administer in a school system is definitely a benefit to the kids. We actually had a speaker recently at Rotary talking about Narcan and the opioid crisis. And they really are encouraging for all citizens to get some type of knowledge and possibly training on how to administer. It's not a shot, it's just a nasal spray. No different than doing a nasal spray.
Are they doing Narcan or maybe Narcan and naloxone are the same thing? I thought it was a naloxone that they were doing.
I'm not sure.
Honestly, I can't answer. I thought it was Narcan, but
okay.
But it's a good step that we are doing for the kids. We don't want our kids exposed to it, but let's be real. As soon as we step out of the doors of the studio, all of us are exposed to the poison that's in our society.
Ron?
It's a difficult thing. I'm glad to see the governor determined that it was a crisis. And that he has put an extra effort on it. I see the federal government the other day started out where Secretary of Health and Human Resources said it wasn't that big of a problem. And I think maybe it was later on the day or the next morning the president said, oh yeah, it is. So we're going to declare a national emergency. I think it is an emergency. And I think in our own local community, have to give kudos to Councilwoman Keller for what she's been involved in, trying to bring it to our attention to do more locally. One of the things that I think should be done far more than it is, I think the doctors and the hospitals ought to be far more involved in this than what they are. I think they help perpetuate and create the problem, and I think they should be helped solve the problem. I don't think it all ought to go into elected officials and law enforcement to fight something that's been created by the prescriptions that's been given out through pharmacies and through our medical system.
Now, I was told during the presentation we had is that the state is starting to, by October 1, physicians who have the ability to write out opiate prescriptions need to start registering and recording what's going on. I think that's a positive step. I think the medical community is aware of we have a big problem. Okay, so no longer you go in there for minor surgery and they're going to prescribe you 100 Percocet. They might give you 1 or 2 to get you through for a couple days and then gauge it from there. So we're making the right strides. I don't want to see us repeat a war on drugs that we had from 30 years ago because we failed in that war on drugs. We need to be more interactive. We need to intercede earlier, realize that people who have problems need to be treated and not necessarily incarcerated all the time.
That's a great point.
My other concern with the dosage, for the anti-drug, so to speak, is that we start tracking that. Opioid-related usage or overdoses is down in our community so far this year. But we've also had Narcan and other drugs out there to counteract opioid issues. Let's start tracking the use of Narcan because I hear reports of people actually kind of playing Russian roulette. Let's see how high I can get and be brought back. So let's start tracking the Narcan usage when people go and they get a refill because I had to use it. Don't make it cumbersome, but just have some type of simple reporting system.
What's interesting on this school thing, the nurses will have to report whenever they use the naloxone or Narcan, whatever they're using, to the state. So there is a reporting mechanism at the school level. And again, I think this is a very positive step as well, but how many of these overdoses happen on school property during school hours?
That's a good question. I have not seen
and I would-
the
okay.
statistics.
But I mean, the
Yeah.
majority of them that I've heard of locally have not happened. They're
Yeah.
on an evening or a weekend, and they're off in an alley somewhere.
But Jim, if there's one that can be prevented,
no, I get that.
okay,
I'm not arguing.
I'm sorry to be, it's not at a significant expense to the school system when we're all said and done. It's the value of keeping someone alive. I think that's where we're addressing it.
I know I pick medicine up for my mom, and there's some of it I have to pick up with my driver's license. I can't pick it up without driver's license. But I've noticed in the last 2 months, far more questions are being asked when people go to pick up prescriptions. I'd notice a total different image at the counter where medicine is distributed than I did before.
Well, and we are, and I'm
To the better now.
And I'm encouraged by some of the things that I've seen. Is going back to the point where they took these narcotics and they made them time release. So if you sit and pop this pill, you're not going to get that immediate high that you would have under the old style of pills. They as you said, they stopped issuing 30 or 60 or 90 of them at a time. I remember I had a procedure back, I don't know, 10 years ago or so, and they sent me home with 30 pills and three
refill,
refills.
right.
And I didn't use 2 of them. So those things sat in my drawer for years until they finally, at some point, they did that. You can take them into the police department and dispose of them. And that's how I finally got rid of them.
But that having them sit in your medicine cabinet when you have youngsters at home, that is the largest risk. That's how they can gain access.
But we are moving forward. But I think one of the things you said that I completely agree with is we need to maybe expand it beyond the schools. Who else can we train to get this done?
Well, I think you've got your fire companies, because they're first responders a lot of time, even before the ambulance gets there, so the ambulance has got enough help, or vice versa. So you have those folks. Wasn't it Rush Limbaugh that got that? Remember, he got hooked on oxycodone back so many years ago, and and that created a problem and a stir. So
train everyone.
Yeah.
That's my role. At any rate, next up on the flip side, Montgomery County did a study, and there could be 47,000 jobs lost in the state. We'll find out why in about 3 minutes.